today we're exploring a role that's absolutely critical on the front lines of healthcare, the certified nursing assistant or CNA. And our source material for this deep dive is really interesting. It's an interview transcript. So we're getting a direct firsthand look at this career path.
Yeah, that's great because hearing from someone actually, doing the job, it cuts through a lot of the official descriptions and gives you the real deal.
Exactly. So our mission today is to take that transcript, dig right in, and pull out the essential insights, the absolute must-knows about becoming a CNA and what the work is really like.
So you get a clear picture fast.
We want you to walk away understanding the role, whether you're maybe thinking about it yourself or just want to appreciate what these folks do.
It's fundamental work, truly.
Okay, so let's jump in. The transcript, it really throws you right into the core of the job. What stands out immediately is just how hands-on it is.
Oh, absolutely.
The source uses the phrase front lines of patient care, and it feels right.
It really is direct care. The day-to-day stuff, it's not always glamorous, maybe, but it's completely foundational. We're talking patient comfort, dignity, well-being.
And the source lists specifics, right? Like assisting with personal hygiene.
Mm-hmm. Bathing, dressing, things people might take for granted until they can't manage them alone.
Right, those basic human needs. What about mobility? That came up too.
Huge part of it, yeah. Helping patients get safely in and out of bed, moving around, maybe transferring to a chair.
That sounds like it takes some physical effort, and you'd need to know what you're doing to avoid falls or injuries.
Definitely. Safety protocols are key. It's not just strength, it's technique.
And they're also keeping an eye on things, taking vital signs.
Absolutely. Blood pressure, temperature, pulse, that regular monitoring. It's crucial data for the nurses and doctors.
Okay.
And beyond the, medical-ish tasks, it's also just ensuring basic comfort, keeping patient rooms tidy, making sure they have what they need.
So it's not just a checklist of tasks. It sounds like there's constant, pretty intimate interaction involved.
It is. CNAs probably spend more direct one-on-one time with patients than almost anyone else on the healthcare team.
Wow.
They're the constant presence, really, the eyes and ears on the ground.
Okay, so hearing about that kind of essential, really hands-on role, you might wonder, how do you actually get ready for that?
Right.
And the source sheds some really interesting light on becoming a CNA, the whole training and certification part.
Yeah, and what's really striking, and I think this is a key takeaway from the interview, is just how fast you can potentially enter this field.
How fast are we talking?
The transcript mentions that a full-time training program is often done in around just 8 weeks.
8 weeks, seriously. That feels incredibly quick to step into a role with that level of patient care responsibility.
It does sound fast, doesn't it? But the training is intensive and it's very focused.
So what does it actually cover in those 8 weeks?
Well, the source explains it's a mix. You've got classroom instruction covering the basics, some relevant anatomy, patient rights, how to communicate effectively, and then crucially, there are mandatory clinical hours.
Ah, okay, so that's the hands-on practice part.
Exactly. Under supervision, you're practicing the actual skills you'll use every day. How to safely transfer someone, the right way to help with hygiene, how to take vitals accurately.
So they're trying to get you competent in those core tasks pretty quickly.
That's the goal, yeah.
And all of this leads up to the big final step, the state certification exam.
Yes, you have to pass that to be officially certified. And the source confirms it's usually 2 parts.
2 parts.
A written test, checking your knowledge of the concepts and rules. And then, importantly, a practical skills test.
So you actually have to show them you can do it.
Right there, yeah.
Oh.
Demonstrate you're proficient in several of those hands-on tasks.
Okay, so that 8-week track, it's not just sitting in a classroom. It's building skills and then proving you have them. That's actually a fascinating way the system gets essential people trained up.
It really is a kind of fast track into the healthcare workforce.
Which, leads us right into the practical side of things. Like, what's the job outlook? What about the pay?
Good questions. And the source is pretty clear on the demand for CNAs.
High, I'm guessing.
Exceptionally high, yeah. And the reason is, well, it's pretty straightforward. The aging population.
Right. More older folks needing care.
Exactly. It's driving a huge need for skilled caregivers, support staff. You see it in hospitals, nursing homes, home health settings, everywhere, really.
And did the source give any, hard numbers on that demand?
It did. It mentioned something like 56,500 openings projected per year across the country.
Wow, 56,500 a year. That's a lot of openings. Suggests some job security there.
It really underscores the stability, yeah, and the opportunity. Now, about the income, The interview transcript describes it as a solid starting wage in healthcare.
Okay. Did give a specific figure?
Yeah, the median annual pay cited was around $38,000. That was based on May 2023 data.
$38,000 median.
Right. And it's important, to stress that's a median. Pay can definitely vary.
Based on what? Location?
The location is a big one,
Yeah.
yeah. Where you live matters. Also the type of place you work, hospital versus nursing home, maybe, and, of course, your experience level.
Sure, makes sense.
But still, as a starting point for a job you can potentially train for in just 8 weeks, it offers pretty significant access to a stable income.
Okay, right. So let's recap a bit. We've got this demanding, very hands-on role, a remarkably fast training path to get certified,
Yeah, that 8 weeks.
really high demand for the job, and a solid starting wage. But here's where the source material brings in something really interesting, maybe even transformative. That for many people, the CNA role isn't actually the end goal. It's a stepping stone.
Yes. This is maybe one of the most compelling points from the interview, I think. It's explicitly framed that way. A fantastic, really invaluable stepping stone if you want to move up in nursing or other healthcare fields.
Okay, but why is it such a powerful stepping stone? What does being a CNA give you that, I don't know, you couldn't get just going straight into nursing school?
That direct patient care experience, period.
Okay.
The source really hammers this home. That real-world interaction, learning how to communicate effectively, often under pressure, understanding the whole healthcare environment from the inside.
How things work, how the different jobs connect.
Exactly. How a facility operates, how the team interacts. That's priceless foundational knowledge. You learn the actual rhythm and reality of patient care from the ground floor up. You just can't replicate that in a classroom alone.
And the source mentions specific pathways, like common routes people take after being a CNA.
Absolutely. A very common one mentioned is going from CNA to licensed practical nurse, or LPN.
Okay, LPN, how long does that usually take?
The LPN program is typically about 1 year long.
So wait, you could do 8 weeks for CNA, get that experience, and then layer on just another year to become an LPN. That actually sounds like a pretty quick progression.
It is, relatively speaking. And then many LPNs don't stop there. They continue their education to become registered nurses, RNs.
Ah, okay. The RN path.
Right. And the source mentioned the two main ways to do that. Either a 2-year associate's degree in nursing, an ADN, or a 4-year Bachelor of Science in Nursing, a BSN.
So that CNA experience, it's not just giving you a job. It's a practical paid entry point into the whole healthcare world.
Oh, precisely.
It lets you learn, build skills, earn money, and then decide if you want to go further, but with this really solid base already built.
Exactly. It provides that crucial real-world context. It makes the later nursing education, more meaningful. And honestly, it probably makes you a stronger candidate for those programs, too.
Okay, so let's try and pull all these threads together from this deep dive. The CNA role, it's intensely hands-on. Right there, front and center for patient well-being.
Absolutely, on the absolute front lines.
And it's a career path you can enter remarkably quickly. Maybe just 8 weeks of focused training, then you get certified.
Yeah, that speed is definitely a key point.
Then there's the demand, really high, driven by demographics, which means pretty good job security and a solid starting income.
Definitely strong demand. And that $38K median gives a starting point, though it varies.
And maybe most importantly, the source reveals it's often this powerful stepping stone. It gives you invaluable experience that sets you up directly for advancement.
Right, towards LPN, towards RN. It opens doors.
So hopefully this dive has kind of illuminated what's clearly a vital, maybe sometimes underestimated role in our healthcare system and given you a clear picture of the journey within it.
It's essential work, it's accessible work, and it really does offer that upward mobility. It's quite a combination.
So here's a final thought to leave you with. Given how absolutely central the CNA's moment-to-moment tasks are, the bathing, the helping with movement, just being that constant presence for comfort and dignity, and how fundamental that direct care is to any patient's actual experience. What does the truly essential nature of this specific work suggest about where the real indispensable bedrock of our healthcare system actually lies?
That's definitely something to think about.